Outside the pharmacy doors, the smell of coal smoke hung over Berlin's streets, while inside, the new bottles stood lined in orderly ranks behind glass. A visiting physician read the bold claims in a Bayer circular, tracing a finger over promises of safe, dependable sedation and superior cough relief. He folded the leaflet into his bag alongside a stethoscope and worn prescription pad, already thinking of patients whose sleepless, racking nights might finally yield to this refined opiate. Soon, freshly printed formularies listed heroin beside familiar remedies such as codeine, laudanum, and morphine, but with an added note of optimism. Medical journals carried case series in dense, small type, reporting quieter wards and fewer agonized cries from consumptive patients. In lecture halls, professors of internal medicine described heroin as an advance of chemical precision, something that allowed the physician to modulate pain and cough with a modern, standardized preparation instead of crude plant extracts. Pharmacists in other European cities unwrapped shipments stamped with Bayer's emblem and arranged the vials in front displays framed by polished brass scales and dark wooden shelves. Handwritten labels for lozenges, elixirs, and injectable solutions all bore the same confident name. Prescriptions arrived from clinics and private practices, specifying small, neat doses for children and adults alike. Each dispensed bottle left the counter accompanied by quiet assurances that science had delivered a potent but trustworthy ally against suffering. In hospital wards filled with the rattling breaths of tuberculosis and pneumonia, physicians measured morphine in careful grains, pushing syringes beneath pale skin. Beside the beds, glass bottles of laudanum caught the light, their handwritten labels smudged by anxious hands. Apothecaries mixed opium tinctures with aromatic syrups, promising soothing nights to parents terrified by a child's whooping cough. Newspapers carried advertisements boasting of gentle sedatives, while few lines mentioned the lingering need that often followed relief. In cramped city rooms, laudanum bottles stood near cooking pots and wash basins, as familiar as bread or coal. A mother with a hacking winter cough swallowed a spoonful before lying down, then another in the small hours when the spasms returned. In quieter, carpeted homes, respectable patients kept opium-laced cordials in polished cabinets, offered after dinner for nerves and sleeplessness. Letters between physicians described grateful reports of eased coughing, but also restless nights when the medicine ran out. At medical society meetings, some doctors exchanged uneasy observations. Patients who started with a few drops of laudanum now begged for stronger doses of morphine, complaining that former amounts no longer calmed their chests or their minds. Journal articles described trembling hands, sweating skin, and agitation when opiates were abruptly stopped. The term morphinism appeared in clinical notes, marking a new category of suffering. Opium remained the most reliable tool against severe cough and pain, yet it clearly carried a growing, troubling cost. In the late 19th century, benches in European chemistry labs were crowded with flasks, retorts, and the sharp smell of coal tar derivatives. Chemists heated, cooled, and crystallized compounds, chasing subtle changes in molecular structure. Acetyl salicylic acid emerged from this work, showing that a slightly altered plant molecule could relieve pain and fever with fewer dangerous side effects. That success encouraged the belief that other troublesome drugs might be tamed by careful, targeted modification at the chemical level. Physicians, wrestling with morphine dependence among patients, studied these developments with growing interest. Case reports described men and women who had entered clinics with injuries or chronic coughs and left months later unable to stop taking their medication. Editorials in medical journals argued for a rational solution: retain opium's capacity to dull pain and quiet the lungs, but blunt its grip on the mind. Many doctors placed new hope in laboratory colleagues who promised gentler analogues of familiar alkaloids. In this climate, chemists approached the opium molecule like a puzzle that could be solved with acetyl groups and careful purification. They believed that redirecting how a drug moved through the body might mute its most destructive tendencies. Pharmaceutical firms funded experiments that transformed known alkaloids into new substances, each one tested for its effect on pain, breathing, and mood. The goal remained clear: a potent, reliable cough medicine derived from opium, yet supposedly freed from the shadow of addiction. In the crowded Bayer laboratories in Elberfeld, glassware clinked and steam curled above benches as chemists refined familiar alkaloids. Among them, a derivative of morphine, diacetylmorphine, crystallized in small batches, catalogued and labeled with careful handwriting. Discussions among staff circled around its unusual profile, a substance that seemed to quiet pain and deepen breathing in test animals, yet produced less immediate nausea and constipation than the morphine they already knew so well. Heinrich Dreser and his colleagues reviewed notebooks filled with dosing tables, pulse counts, and respiratory measurements. Dogs and other laboratory animals lay on padded tables as observers tracked their slowed, then steady breathing after injections. Early human tests unfolded in hospital wards, where patients with stubborn coughs or chronic pain swallowed or received the new compound. Reports described rapid relief, calmer sleep, and a striking sense of well-being, with few alarming reactions noted in these initial, closely watched cases. Inside Bayer's offices, typed memoranda circulated, proposing diacetylmorphine as a medicine for tuberculosis-related cough, bronchitis, and even as a cure for morphine dependence. Employees repeated stories from test subjects who spoke of feeling unusually strong and uplifted. The term heroin, drawn from the German word for heroic, appeared in draft labels and advertisements. Executives and chemists together envisioned an emblem of scientific progress, a refined modern drug that would surpass older opiates in safety, elegance, and therapeutic promise. In hospital wards, thick with the sounds of hacking chests, physicians reached for small glass ampules labelled with the new word, heroin. In London and Manchester, it quieted the wrenching, bloody coughs of advanced tuberculosis that had tormented patients for months. Doctors noted the sudden calm in their casebooks, marking reduced frequency of coughing and improved sleep. On morning rounds, they listened to shallow but unbroken breathing and praised this seemingly precise modern medicine. Across Germany and France, similar ampules and powders rested in orderly rows on pharmacy shelves. Heroin appeared in national pharmacopoeias with carefully specified doses for pneumonia and bronchitis, its antitussive power described as superior to morphine. Physicians ordered it for gasping, feverish patients whose chests rattled with every breath. After injections or drops, ward air grew noticeably quieter, interrupted only by occasional coughs. Doctors attributed the relief to a rational application of chemistry and progress in scientific therapeutics. In American cities, doctors prescribed heroin not only for stubborn coughs, but also to ease post-surgical pain and, paradoxically, to help some patients withdraw from morphine. Bayer and competing firms distributed advertisements showing ampules, tablets, syrups, and lozenges that featured heroin as a mark of quality. Pharmacists compounded sweetened cough mixtures for children and adults, sold over the counter and by mail order under names like heroin hydrochloride. Nurses recorded grateful patients finally sleeping through the night, reinforcing confidence in this new remedy. In crowded hospital wards and quiet private practices, the pattern had repeated itself with unsettling consistency. Patients who had first reported dramatic relief from racking coughs now returned sooner than expected, describing shorter intervals of comfort. A clinician in Vienna measured doses with care and watched the numbers creep upward in his notes. The same quantity of heroin syrup no longer quieted the lungs as before, and requests for refills became more insistent, though few yet called it dependence. Across the Atlantic, concern deepened in smaller circles. In New York, a physician who had adopted heroin as a progressive treatment for morphine dependence followed one particular patient closely. At first, the change seemed promising. Injections of the new drug eased withdrawal and softened the familiar pains. Over weeks, however, the patient lingered near the surgery, asking for slightly earlier doses, then for take-home vials. The old craving had shifted course, attaching itself to the supposedly safer remedy. Medical journals carried brief, easily overlooked signals. In The Lancet, a short communication described restlessness, sleepless nights, and abrupt mood swings in patients maintained on heroin for chronic cough. Similar notes appeared in the Berliner Klinische Wochenschrift, mentioning agitation and odd behaviors among long-term recipients. Outside clinics, health officials quietly recorded individuals obtaining heroin through informal cellars and pharmacy back doors. Yet ward rounds and professional meetings still echoed with reassurances, framed by trust in pharmaceutical claims and a desire to avoid repeating the turmoil surrounding morphine. In crowded city streets, signs above chemists' doors announced the latest remedies, and among them heroin preparations stood beside liniments and digestive tonics. Glass bottles with ornate labels promised relief from stubborn coughs, bronchitis, and sleepless nights. In shop windows, tins of heroin lozenges lay arranged next to throat pastilles and colds powders. Inside, assistants measured out small vials, confident in the assurances printed in pharmaceutical circulars and endorsed by respected medical journals. Newspaper columns carried testimonials for heroin cough syrups blended with honey or glycerin, praised for calming the chests of fretful children. Some advertisements showed mothers leaning over cradles, a spoonful of medicine poised above a restless infant, with printed promises of quiet nights and gentle breathing. In doctors' offices, representatives left sample bottles of heroin-codeine mixtures for trial, explaining dosage schedules while pointing to charts of respiratory complaints and seasonal colds. Away from the polished counters, another pattern appeared in police ledgers. Officers recorded break-ins at small pharmacies where only narcotic stock seemed to vanish, and magistrates heard cases of unregistered sales made through back doors to familiar customers. In crowded tenements, social workers and temperance advocates listened as families described mounting costs and mysterious dependencies. Reports began to single out heroin, noting how a once-celebrated remedy had begun to leave unmistakable marks on vulnerable neighborhoods. On crowded medical wards, physicians watched patterns they could no longer ignore. Patients who had arrived with pneumonia or tuberculosis now clutched small vials, pleading for the same relief that once quieted their coughs. Notes in hospital ledgers described a growing need for higher doses and agitation when injections were delayed. In clinics, pharmacists refilled prescriptions with a wary hesitation, remarking on familiar faces returning sooner than any therapeutic schedule required. Articles in respected journals laid out case histories in stark detail. Formerly healthy workers, prescribed heroin syrup for a winter bronchitis, reappeared months later, emaciated and desperate, unable to work without the drug. Descriptions of restlessness, cramps, and waves of nausea followed every attempt to taper the dose. In city tenements, neighbors recognized the same hollow-eyed look once associated with opium dens, but now linked to a medicine previously advertised as modern and safe. Lawmakers and health officials read these accounts as they examined customs reports from major ports. Crates labelled with chemical trade names concealed ampules and powders that moved from docks into clandestine markets. In Shanghai's foreign concessions and along New York's waterfront, police raids seized both opium pipes and small glass bottles marked with the same alkaloid. At professional meetings, physicians stepped to the podium to question whether a drug causing such devastation could still be justified as an ordinary remedy. By the mid-1910s, ward corridors no longer echoed with casual requests for heroin. Hospital administrators filed new ledgers, tracking every grain of morphine and heroin under the Harrison Act's rules. Pharmacies locked their opiate cabinets and logged each prescription for federal inspection. Patients who once renewed cough mixtures without question met stricter scrutiny, while some long-term users discovered that their familiar drafts suddenly required complex paperwork or disappeared altogether. Across the Atlantic, British officials catalogued addiction cases and convened medical advisors. The 1920 Dangerous Drugs Act tightened supply, forcing manufacturers to justify every batch and doctors to defend every order. International delegates met in Geneva, drafting revisions to the Opium Convention that placed heroin near the center of concern. Shipping manifests shrank. Export licenses faced rejection. Warehouses that had once stored branded heroin tablets gradually emptied under the new regime. In clinics, physicians reconsidered the contents of their medicine chests. Pharmacopoeias from the 1930s printed stark warnings, where earlier editions had praised heroin's reliability. Some volumes dropped the drug altogether, listing codeine as the preferred cough suppressant and recommending newer, non-narcotic preparations when possible. Chemical glassware that had measured out diacetyl morphine now stood idle, while Bayer and other firms redirected research funds toward compounds that promised relief without the growing spectre of dependency. In the lamplight of 19th-century wards, bottles of heroin cough syrup once stood beside thermometers and stethoscopes, symbols of a new chemistry that promised precise control over pain and breath. Physicians measured out drops to quiet racking, tubercular coughs, noting in careful script the easing of spasms and the softening of gasps. Each dose seemed to confirm their trust that laboratory refinement had tamed the opium poppy into something predictable and humane. Decades later, graphs of overdose deaths and images of improvised injections exposed how thoroughly that trust had been misplaced. The same molecule that had calmed consumptive patients now appeared in toxicology reports and police photographs, its name recast as shorthand for ruin. Researchers traced the arc from patent medicine advertisements to emergency rooms, showing how delayed recognition of dependence had allowed a remedy for coughs and pain to seed waves of compulsive use and criminalization across continents. In quiet clinics in cities like Zurich and Frankfurt, a different scene unfolded. Under locked storage and strict protocols, nurses prepared measured injections of pharmaceutical diacetyl morphine for people whose opioid dependence had resisted every other treatment. Regular dosing, medical supervision, and social support reduced illicit use, disease transmission, and death. The cautious routines in these rooms, built on grim historical memory, demonstrated how the same drug could either deepen catastrophe or narrowly contain it.